Now, to move on to think a little about one of the key debates, and was one of the aims of this session, was to think about the relationship between exposure to gambling and gambling behaviour. Traditionally, it's been argued that increases in exposure to gambling will lead to increases in gambling behaviour, which will lead to increases in problematic play. Therefore, some have argued that an effective way to prevent harm is to restrict opportunities to gambling. However, what we really need to do is assess that theory by what the evidence actually tells us. In Great Britain, many people have argued that since the 1990s, exposure to gambling has increased, particularly with the advent of the internet. But we've also had the 2005 Gambling Act, which for some has increased gambling accessibility. Now, it's far from agreed as to whether there is a set evidence base which says that gambling availability in Britain has increased, but many people have made that argument. So if we accept that accessibility has increased, what exposure theory tells us is that participation rates in gambling should have increased. However, when we've looked at data from the British Gambling Prevalence Survey, we see that overall participation rates are relatively stable. The estimates we saw in 2010 were very similar to the estimates observed back in 1999. So this makes us think that, firstly, the relationship between exposure and behaviour is much more complex. It's not necessarily linear. However, what we have seen in Britain are some really key changes in gambling behaviour. So whilst overall the number of people participating in gambling hasn't changed that much, those people who do participate in gambling tend to gamble more regularly than they did previously and tend to gamble on more types of activities. So we're seeing a change in the pattern of gambling behaviour amongst gamblers, and we're also seeing some changes in the patterns of consumption. It's really important, I think, to dig deeper into gambling behaviour, to try and understand what's happening, to look at those kind of frequency distributions, because as you've just seen, if we just focus on top line figures, you can actually get a very misleading picture. This also highlights the complexity of of considering this issue. Evidence from our surveys, which is supported by that from treatment providers, is that people who experience problems with their gambling behaviour tend to take part in a range of different activities quite regularly. It's relatively rare that a problem gambler will just take part in one activity. That's actually got a really important practical implication in terms of developing responsible gambling strategies. If we know that problem gamblers are the most engaged in a range of activities, having a joined-up approach across all sectors, across all operators, by which the same protocols, procedures, and strategies to prevent harm has got to be the most effective way to try and intervene with those people. And that's, again, I think, where this debate is so useful in terms of starting to think about how that may be achieved. Could that be achieved? There are also certain sectors of the industry that I think are better placed to be able to promote responsible gambling strategies. And as Malcolm said, the online industry in particular. We know that people who gamble online tend to be people who are more engaged in gambling more generally. And because they are more engaged, they may have a greater risk of experiencing some kind of harm. However, what this means is that online operators have a real opportunity to interact with a vulnerable group, to try and promote responsible gambling with that group, to again have the same messages, the same strategies. And that should be something that we should be considering in a joined-up way. My soapbox moment. So really, when we're trying to understand gambling behaviour and thinking about how to minimise the risk of harm, we need a much more coherent education, prevention and research strategy. We need different sectors to work together. We need treatment providers and researchers to look at what their data tells them about the nature of problem gambling, those at risk, about its etiology. In Britain, we've been rather better at looking at the top half of this circle. We have run population-based studies, and we have initiatives such as Dr. Bowden-Jones's with research with treatment seekers. What we haven't really capitalised on are the new opportunities that working with industry partners affords. As Malcolm said, the industry data that could be used to help explain gambling behaviour, that could be used to generate risk profiles, that could be used to try and improve our responsible gambling strategies. But we also crucially need better interaction and a better dialogue with the administrators, the regulators and the policymakers. If we're really going to understand how gambling exposure affects gambling behaviour, we need concrete data on the distribution of gambling, not just based on localised observation or anecdote, as sometimes it can be made. So really, I think when you look at this diagram, each quadrant here has the power to answer different questions or different parts of this complex question. And it's really only when we start to approach this in a joined up way that we can truly understand gambling behaviour and its impact. Thank you.